Good afternoon, everyone. My name is Mark Haskelson. I'm the president of Compliancy Group, and I want to thank Apex for being kind enough to let us speak to you guys today. Today we're going to be speaking about how not to fail an audit. Bob Grant, the Chief Compliance Officer of our firm, will be doing the presenting, and we really appreciate you guys taking the time out of your day. We will be recording this, and you can access it from Apex and their staff, so if there's any questions, please do ask questions. For those of you who are familiar or not familiar, on the right-hand side, you should have a question box. Please post your questions. It really makes this more interesting. What I will do is, depending on the timing of the question, I will either interrupt Bob in between slides or perhaps save them to the end. It really depends on the nature of what you're asking, but we really do appreciate them. And there is no such thing as a question that is, there's no dumb questions, and no, I promise I will not read your names out loud, so you are asking anonymously. George, I don't know if you want to say a few words.
Certainly. Thanks, Mark. I wanted to thank everybody for jumping on the webinar today. The reason we're having this is we've worked with a lot of healthcare clients over the years, especially the last 2 years through CalHIPSA, which is the Regional Extension Center for Meaningful Use in California. And basically the government paid us through that program to do a lot of security and risk assessments as part of Meaningful Use core measure number 15. And what we found was obviously a lot of practices and organizations that needed to do a lot of things to become compliant, and that the risk assessment was just one of the steps that needs to take place. It's not the only thing that you do. So the information today is going to really give you a good picture of everything you need to do to truly be HIPAA compliant and maintain that over time. So without any other delay, let's go ahead and jump into that. And Bob will be jumping in next. Thanks.
Well, thanks, Mark and George. I'm Bob Grant. I'm co-founder of Compliancy Group and co-author of The Guard. The Guard was built off of many audits that have been accomplished over the last 10 years across the United States. I was the subject matter expert and the assessor for LA County, which was 1,200 clinics and 9 hospitals. And during the audits that happened at LA County and Queens Hospital System in Hawaii and the state of Tennessee and the state of Louisiana, we found that there was a methodology of how to do an audit and how to simplify an audit, which we turned into a tool to help people to be able to show the necessary information to pass an audit. But there are things that you can do. Right? You don't have to have a tool, which makes, you know, Mark and George go, wow, right? But you could do this yourself, but you're going to need 12 Excel spreadsheets and things like that to get it done. And I'm going to go through what you're going to need to have in place for that. But let's talk about your compliance right now. I tell this story all the time. When I go to conferences, I don't get up and stand in front of the booth anymore. I sit in the back and I wait to talk to customers about compliance, right? How is your compliance plan? What are you doing? How are you doing it, etc. But I also watch people go by. And so at the conference, they're really into this booth and that booth, and then they come and they see compliance, and it's like, Lord, you must have a virus on you, just right on your face. And then people will just turn away and walk and just keep walking by and then look at the next booth. It's like they don't want to hear it, they don't want to see it, they don't want to talk about it, right? And if you do get them and you do ask them, how's your compliance going? We're 100% compliant, and just keep walking. Well, when people say they're 100% compliant, I always kind of shiver a little bit, because you can't be. That's why the regulation doesn't say that you have to be compliant. Why? Because you can't. Because everything changes in healthcare from day to day, week to week, month to month, year to year. New employees, new regulations, new policies, new changes, right? So it's constantly influxing inside your business, and you have to keep up with it. So if you're in this stage right here, you're probably not compliant, and you're probably close to neglect. Now, you've heard this before, right? Buy my policies, put my policies in place, and you will be HIPAA compliant. If you did that and you think you're HIPAA compliant, you're going to fail. How about this one? How about this one? If you get my workforce training and you put it in and you train your staff, you're going to be HIPAA compliant. How about if you did that? Would you be compliant? No, you're going to fail. How about this one? Do a risk assessment. Look at your technical side. Make sure that everything is secure and everything, and you'll be HIPAA compliant. Do you pass? No, you don't. The reason why you don't pass, because it's a combination of all three. It's the risk assessment that tells us what's wrong, then you remediate it, and you remediate 80% of it by the policies and procedures. And you have to do this year after year after year. That's why people fail. They don't, and what this is called, all of these together, this handshaking, is a compliance plan. That's what the government looks for. That's how they know if you're doing your due diligence. So, as we talk about a lot, is compliance as a service, right? It's not just somebody coming in from the outside and doing it once and walking away. It doesn't work like that. Compliance is, like I said before, it's every day, every week, every month, every year, right? And the only way to do that is to have a combination of some place to store it all and somebody doing the hard things, like whether it's a vulnerability scan or looking at your network or looking at, maybe taking your stuff and putting it in the cloud, right? But it's also having somebody audit you and looking at your policies and your procedures for privacy, security, breach notification, and being able to show the government that you have this all in place, including training of your staff, okay, on each policy. Not giving them a printed out little folder, a little stapled thing of all the policies together with a sheet on top that says sign this if you understand these. You know that never works. You know what happens. You've been there before. You've gotten that packet and you've gone through the first 2 pages and just says, I'm just signing this. I'm not reading this. And then they're the people that breach. So without that type of maintenance, making sure that your employees understand each and every policy, you're going to end up having breaches. And the government, that makes the government come to you more, right? It's kind of like a magnet, right? Anyway, so what does this all do when it's in place? It protects your reputation, okay? Yeah, the fines are fine. Yeah, we're going to have fines. But what happens is if you have a major breach and it's in the newspaper, this is what you lose. You start losing pay. It's kind of like Yelp. It's kind of like that restaurant down the street, that great restaurant that you go to. And you go to that restaurant every time because it's your favorite. Finally, you see on Yelp that they had this problem and that problem, and then you kind of go there and you start looking and you say to yourself, yeah, I see that now. I'm not coming back here anymore. It's the same thing for your practice. Same thing for your hospital. Same thing for your clinic. If you get bad reputation, guess what? They're not coming to you. They're going to find somebody else, and all of a sudden, this person that you've had coming to you for years and years and years finally is not coming anymore. They don't tell you why. The reason why is you lost your reputation. So whether it's so having this in place helps you to save that. Now, you have this big misconception because you've got two entities you're facing here. You're facing CMS for meaningful use, and you're facing HHS for the HIPAA federal regulations. Okay? CMS, which you signed up for meaningful use, which George was talking about, gives you money to put in your EHR system. Okay? But they ask you to jump through these 18 odd core requirements for stage 1, and it's a little more for stage 2. Okay, but you're looking at core requirement 15 and core requirement 9. The reason why a lot of people are having to give back money for meaningful use is when they got that audit and they looked at it, it had all of this stuff about EHR. So the doctors, the practice, the entities assumed that the hospital information system or the EHR system was going to be covered by that company. But that wasn't true. And no one told them. The EHR company didn't say anything. The federal government just said you had to do it. So they looked at it and said, yeah, well, I guess, if this is all EHR, so I'm going to check that off. Then when they sent it in and they got the money, then they got an audit. And when they filled out the audit, they They call the EHR company and say, I need my risk analysis for this. And they said, well, you were supposed to do that. What? So when they sent the audit in, the Meaningful Use said, give me my money back. So they had to give back the $17,000. That's not good, right? That's because of lack of communication from CMS, because CMS, puts it on the website, expects you to read it, right? And your EHR company didn't want to tell you, wasn't going to tell you, because then you were going to say, well, why aren't you doing this for me? Well, they weren't going to tell you either. So then what happened is you're stuck in a hole of having to give this money back. That's giving money back, though. That was money, you're giving money back that they gave to you. That may hurt a little bit, but you had to do it. Now let's talk about these guys over here on the left, these HIPAA guys. Okay, so these HIPAA guys have been in place. They put the regulations in place 10 years ago. 10 years they've been out this year. Now, they've gone along every year on the honor system, okay? We'll call it the honor system. So they expected people, either the public or another employee or the practice itself, to report incidents, okay? And you know how that went. Nobody really did it. It just kind of was there. For the ones who did do it, it was because everybody knew, so they had to, and those guys got fined heavy, okay? But all in all, across the whole United States, it wasn't really maintained. They didn't come out, they didn't audit. Everybody knew about the HIPAA Police, but nothing ever happened. So what happens normally? If you're not going to get caught, you're not going to do it. So people, some people did, some people didn't. Then came Anthem. And when Anthem got breached, and 1 in 4 Americans, their information was breached out, and potential losses of identities and things like that, Congress came down hard on the Office of the Inspector General, who then turned around and came down hard on HIPAA, the Office of HIPAA. So now they're starting. They've had this plan in place. Last year they audited people, and they found out that 70 to 80% of healthcare entities are not compliant. Okay, so when they saw that, Congress said, you need to get your fannies out there, and you better start making these people comply. Okay, here's a short story. Okay, the reason why HIPAA, and I'm going to go one more because I'll come back to this one. Okay, the reason why HIPAA was put in place originally, there's a couple of different reasons. But the first reason why it was put into place was to stop employers from looking at people's medical records and hiring and firing and promoting people because of their medical records. So what they would do is, if they had 2 candidates, they would hire the healthy one so that their insurance premiums wouldn't go up. But you didn't know that. So they put HIPAA in place, privacy, to stop that. You got to stop that. You can't have that anymore. So they did. Okay. Then the banks had a rule called Graham-Leach-Bliley. Graham-Leach-Bliley was put in place because people were hacking banks, and they were taking the information from the banks, and they were stealing people's identities. So the government said, this is like 15 years ago, right? The government said, no, 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 you can't do that anymore. Here's a new law, Graham-Leach-Bliley, privacy, security, make it happen. Banks snubbed their nose, government fined them $1 million a month till they became compliant. Banks said, whoa, we will, they did. Couldn't hack in anymore, okay? So then the hackers went, well, what's the next best place we can go to that has all the information a bank does? Healthcare. Healthcare's got addresses, healthcare's got social security numbers, they've got credit card information, they got everything a bank has. So who do they attack? They start attacking the healthcare. So then HIPAA had to put in new security regulations. And then they advanced, so then they've got HIPAA privacy and HIPAA security for covered entities. Covered entity. You're a covered entity if you're a hospital, a doctor's office, you're creating information, you're billing, things like that. But they left out the business associates. So as you can see how this just is a chain of events that goes down. So now here's a covered entity still doing his business with his business associates and things like that. And now the business associates start breaching the information, but the government can't do anything because they didn't put them in the rule. So then they create omnibus. So now you have omnibus that says you as a business associate now have to comply. So now you've got the business associates trying to comply, and then they turn around and they say, okay, now you two entities, covered entity, business associate, if you breach the data, you're going to have to report it. And now they put in high tech. So this is just 10 years of regulations that weren't enforced. But next year, they're coming out, and they're coming out in full force. Now, what they're going to say is ignorance of the law is not going to get you out of it. You better have a compliance plan in place. And so this meaningful use got added on after. So you could see meaningful use is just a little part of these other guys. Okay? So making sure that you have a compliance plan in place to show your good faith effort in complying with regulations will get you through the audit. Now, I want to show you some trends, okay? There are people, right? There are organizations like Fitbit, okay, who actually announced in a press release that they were HIPAA compliant. They were complying with HIPAA regulation. And this is how important HIPAA is to the public. They went up 23%. Their stock took off because they announced that they were HIPAA compliant. Now, if you're not HIPAA compliant, right, you end up in these situations. You get fined $12,000 and have to give up your license. You can't practice anymore. You get fined $80,000. You get fined $125,000 or $150,000 or $750,000 or $4.4 million and go to prison for 18 months. And as you can see, this is just this year. Okay. So what do you have to do? What do you have to do to show the government? Well, number one, you have to comply with the privacy rule. You have to audit yourself that you're complying with each and every section of the privacy rule. So in our tool, okay, what it does is it gives you a set of questions, and each question is tied to the regulation. So as you're answering the questions, you're actually auditing your practice against the rule. And then at the end, it will come out and tell you what regulations you're not deficient with. And then you'll turn around and build policies for it, so because there's a full set of privacy policies in it. Then you turn around and look at the security rule. Now the security rule it has an administrative side and it has a technical side. Now the technical side has George and his team doing what they're going to do, whether it's a vulnerability test, whether it's a network scan, whether it's a network mapping. You know, there's all sorts of different things that George teams provides to you to make sure from a technical standpoint that you have everything the way it should be. Now from the administrative side, the guard will help you to first audit yourself against the rule and then have the necessary security policies in place. Finally, where we go to high tech is that you have to have a breach notification policy. Now this breach notification policy is about 12 pages long. And what it does is it outlines what you have to do in the event of a breach. Somebody faxes something they weren't supposed to. Somebody sends a list of 500 patients unencrypted and it goes to the wrong place, right? All of these certain issues, and I'll tell you right now, and I say this all the time, healthcare is set up to breach. It is. You've got fax machines that are manually done. You've got printers. You've got paper. You've got electronics. You've got an open site where people are in there. You've got cleaning services. You've got building maintenance, right? You've got a lot of different things with a lot of protected health information in there. And what you want to be able to show to the government is you're making a good faith effort in complying with the regulations and protecting the data, right? That's the key word. We protect the data. And by having this all in place, you're able to show that to the government that you're doing it. I'm going to go by this one. So, as we talked about before, if you're doing meaningful use, you needed to have the risk analysis done. But the risk analysis just wasn't the technical side. You needed to look at the administrative side of security also. Do you have the proper policies and procedures in place, and were your people trained on it, right? So that's for stage one. And then stage two was you need to fix it all. You need to show, okay, we found out what was wrong in stage one, and now we fix it in stage two. Stage three is going to be even more enhanced documentation, which the guard already does, right? So stage one and stage two, right now, it wasn't exactly relayed to the organizations of what they really needed to have in place. Stage three, meaningful use, will. But I've already looked at the regulations, and the guard's already covering you for that. So phase two audits, right? This is what we were talking about before. They've already sent out these phase two audits to everybody. And it was 350 sites, and that's where they found out that 80% are not complying with the regulations. 80% of these people could get fined. That's why they're hiring companies to go and do these audits, because they're probably going to get a cut on whatever the fines are. So when you send that information to you, they're probably going to send back some type of, either they're going to come out or they're just going to send you a fine. So what, as I said before, they don't really communicate this stuff to me. They don't communicate it well enough. They put it out there in periodicals. They put it on their website. They may send you a flyer, and it's not. They have these sign up for our webinar at HHS, right? And how many people actually do that? They don't. You don't really have the time, right? Healthcare is a busy thing. You don't have time to sit there and sit on webinars and hear this stuff, right? So what they're going to look for when they come in, number one, is they're going to want to have written policies and procedures for privacy and security and breach notification that are outlining each and every regulation, meaning when I open that policy, I can see what regulation you're covering here. Okay? They're going to want to know who the compliance officers are, whether it's the privacy security or a head compliance person, because that's the person they're going to want to talk to. They're going to say, where's your assigned security responsibility policy? And then you're going to give it to them. They're going to look down. I need to speak to Bob Grant. Okay, Bob Grant comes forward, and that's who they're going to interview. They're going to want to see that every person has attested to each and every policy, and you have the proper HIPAA 101 training done. And if it's CMS, they're going to want to see fraud, waste, and abuse. They're going to want to know if you have communicated through your training of who these people need, who somebody needs to go to in the event of a breach. Now, in our software, on the very first page, when you log in, you have the ability to post an incident online right to this privacy and security officer anonymously, okay? Because that's what the rule says. You need to do it anonymously, so they can do that, right? You have to do this yearly, right? To show an effective compliance plan, it has to be done yearly. Now, I will tell you this: the first year, if you don't have anywhere near what you're supposed to have, it can take some time. It can take 6 to 8 weeks to get it completely in place with everything going, right? And second year and third year and fourth year and fifth year after that is just basically monitoring and changing what has to be changed after you've gone through that first year of compliance. So there's less work the next years, but you still have to do it. Now, this one right here, enforcing the standards, what you have to have is a sanction policy. So if you look through your policy manual right now and you don't have a sanction policy, you're violating CMS and you're violating HHS. What the sanction policy says is it tells the employee, number one, if you violate the HIPAA federal regulations and jeopardize this company, you can be fired on the spot. Doesn't matter if 3 strikes or not. And it also says if you see something, you can report it to the government and not be. And there's a whistleblower effect. You as an organization can't do anything to them. So it behooves you to be compliant so that your staff doesn't do that, right? Anyway, down here is that you have to, if you do have a breach, you have to respond to it and you have to track how you remediated it. and you have to report that back to the government at the end of the year. So the Guard has a report that you send to them at the end of the year, right? They're going to want to know, you know, I faxed something to Joe's Bar and Grill, I faxed something to another document, we had this, we did that, right? This person complained about that, and then you send it to them. But if you have it's okay to send it to them, because if you have a up-to-date, robust compliance plan, right, it doesn't matter if they come and find you, okay? Because you're going to be able to show them all of your compliance. So now we're going to get into how do you pass this audit, okay? So you have to have a risk assessment each year. And for me, the risk assessment has to cover the administrative, the technical, and the physical. Now, if you comply with HIPAA, okay, then you'll be compliant with meaningful use. If you comply with meaningful use security, you will not be compliant with HIPAA because you have to include privacy. So these audits will cover privacy, security, breach notification on the administrative side, technical and physical on the technical and physical side. Once you have done the audit, you're going to have some deficiencies, and those deficiencies you have to take those deficiencies, you have to remediate them, and you have to show how you remediated them, whether it's a new policy or we did, you know, vulnerability testing and we closed the ports that it found, things like that, right? And so I'm not a proponent of reasonable or appropriate. I don't. I say try to comply with every regulation possible unless, right, unless it's going to impact your organization. And I'll give you one example that I've seen where you cannot, you know, you cannot comply with the regulation. So one of the regulations states that you must encrypt data at rest and in motion. So let's say in your organization you have some really new systems and some really old systems, right? Maybe you have a lab or you have an X-ray, whatever it is. And so if I encrypt the data on my server and I encrypt it at rest and in motion, my lab system and my X-ray system won't work. Okay, well, then we're not going to be encrypting the data, are we? Right? And so, but I have to say why I'm not, and then I have to take additional security measures to protect the data on the server, whether that's an alarm system on the server room, or it's, you know, additional, you know, it's not only in the server room, but it's in a locked box. You know, whatever you have to do, you may have to take additional, you know, steps here so you can show the government I'm making a good faith effort in complying. I'm making a good faith effort in protecting the data. So if they break into my site and they break into my server room, they still have to break into that box to get it. Okay? So you don't want you want to track and monitor that. So you're going to need an Excel spreadsheet that says that, or a tool that does that for you. So now, when you're going through this process now, you have to have policies, procedures. You need to have this breach notification policy. You have to have up-to-date privacy policies, security policies, and you're going to have up-to-date training and then have your people trained on it. You're going to need to have a notice of privacy practice. The notice of privacy practice has to be in a number of different places. It has to be on your website. It has to be hanging in your lobby. It should be available to any existing patients, and you should hand it out and have new patients sign it, that they understand it, and then scan that into the EHR. So there's 4 things that have to be done with that notice of privacy practice. You must make sure that you annually train your staff on new policies and procedures and training. If it goes after 2 years, you're going to want to have them do it again on the policies and procedures. You're going to want to make sure that you manage your business associates. And I bet you a lot of people aren't. So you need to sit back in your office one day and say this: what organizations am I sharing protected health information with? that I've hired them to do something for me. So for example, I hire my collection service. I share PHI with them, they're a business associate. I hired my EHR to help me run my practice, they're a business associate. I hired my hosting company. I hired my IT services. I hired my shredding company, my offsite storage. Any place that you hire somebody to help you and you're sharing protected health information with it for that contract to work. I'm not talking about the cleaning service, the copy guy, the fax guy, building maintenance. They get something different. I'm talking about somebody you actually hire to help you do something, and you have to share PHI with them to have that happen. You need to have an up-to-date business associate agreement with them, and you need to audit them to make sure that they're complying with the HIPAA security rule, because you don't want to face an audit. You don't want to face an audit because your business associate got dinged and they weren't complying. And then they come to you and say, why were you sharing data with them? Well, I've got this beautiful business associate agreement in place. And they're going to say, but didn't you try to find out if they were complying with the rule before you shared with it? How is that protecting the data? And you're going to sit there and go, and you're going to face some type of fine for that. So what I say is, let's get that business associate agreement and let's get an audit, a security audit. And now I have them both in place, and now I feel comfortable in sharing that data. Now, if they refuse to fill it out, that should send a, oh no, Mr. Bill, I shouldn't be sharing data with them. Okay, you need to have an inventory of your devices, right? So you have to know what workstations, what laptops, what CD-ROMs, what backup tapes, what jump drives, and you need to know where these are and how you're protecting them. Are we encrypting them? Do we have antivirus on every system that's connected to PHI? Do we have on our devices that are mobile, do we have remote wipe? Are they encrypted? We need to know that, and it has to be done, and it has to be available to show them. Because look, this is what's going to happen. You lose a device, a laptop, and you want to tell the government, I'm claiming safe harbor, it's encrypted. They're going to say, where's the evidence that it was encrypted? So if you don't have the report that shows that year after year this stuff has been encrypted, they're going to say, I don't see the evidence, we're going to have to fine you. So you want that evidence to be able to show. You want to be able to make sure that you can show all of this together. So let's go. Now here's some of the things we were talking about that could have been avoided. So if you were HIPAA compliant here and you had gone through the whole process that we have, this wouldn't have happened. Number one, this laptop led because they didn't have a media control policy and they didn't encrypt the laptop. So guess what? $775,000. Here you go. Here you go. We don't care you don't have it. Make payments. Okay, so this gentleman right here, right? He mishandled, meaning that somebody took 5,600 sensitive records from him, and he paid $12,000, and now he can't practice dentistry anymore. That's because he didn't have a compliance plan in place. These people right here, they threw. Now this is where the physical side audit comes into play, right? So they threw out PHI in a dumpster. It was found, and because it was so against the rules, they had a class action suit and he had to pay $400,000 for it, and they still haven't been fined by HHS yet. I know that one company called Concentra in California, they got fined $800,000 for it because they did it twice. Look it up. So here you have these. If you're compliant, you would have had an antivirus on here. You wouldn't have had a malware, right? Your antivirus would have caught that, and then you wouldn't have had that on your systems. If you had the policies and procedures in place, then you wouldn't have had to pay $150,000. But as you can see, they just didn't have it. Now, how big is this compliance plan going to be, right? How big by paper are you going to have it, or are you going to have it electronic? So here's a really telling tale. So as I said before, there was no HIPAA police, even though they put out there that HIPAA police are coming, they're coming, they're coming, right? They never did. But if you look at the years of breaches, it was pretty mundane until this year. 112 million. The year's not over yet, right? This is not including what they're going to fine Anthem. So look for this to grow next year when they come out swinging for audits across business associates and covered entities this year. So here's the issues, okay? So each one of these is an issue within your practice, okay? And this is how, and as I said before, you can use, there's any number of different solutions you can use, but you need to have something that does the security risk analysis, okay? The security risk analysis and I should say just the risk analysis, not just the security risk analysis, a risk analysis for administrative, technical, physical, privacy, security, breach notification, okay? So all of this, when you do these audits, which there's 6 of them usually, they're going to tell you what's wrong. And what's wrong needs to go into a remediation plan. And what a remediation plan does, so you did this, right? You did this and you have this. Now you had to fix everything, and you have to show the government how you fixed it. So that's another portion. That's one thing, that's 2. Now, 80%, in most organizations, 80% of this problem is policies, procedures, and training. 20% is technical, 80% is the policies and procedures. So now, you need to have these policies, procedures, and training, and you need a way to track it that your staff understands each and every policy and the training for privacy, security, breach notification. Then, to keep this and to keep all the documentation of how your staff attested this, you need to have some type of document manager. The document manager is where you store all your audits, where you store all your reporting, where you store everything that you need to show the government you're protecting the data. Now, as I said before, you need to also have some type of business manager. The business associate manager is saying, okay, here's the business associate I have in place, here's the audit I have in place, and I review this every year. So you need to have something in place for that. You also have to have an incident manager by law. The incident manager is where the staff goes to report to you that something happened, and then you have to remediate it, and you have to make sure that you have resolved the issues that come undone. Now, if you're not doing this yourself, you're going to have some outside consultant that comes in and does this. Okay? So you're going to have somebody that it comes in and kind of manages it for you. I don't really suggest that, because you should make sure that you understand what's going on. You should be taught how to do this also, and you should be well aware of what's going on. So how do we solve it? Again, you want something that has everything in place. You want something that does the risk analysis for you, for all the risk analysis. You want something that will manage your remediation plans. You want something that says, hey, Mr. Government, this is what we found wrong and this is how we fixed it. You want something that has all the policies, procedures, and training in it, whether they're templates, so you have these templates that you build out that then become your own policies. When they become your own policies, you store them in the document manager. When you store them in the document manager, your staff is going to be attesting to these policies and procedures so that you have a running track of each policy that your employees understand them. You want to make sure that your business associates are up to date and your business associate agreements are in place and you've audited them. You also want to make sure that you have an incident manager. So this wheel of compliance, this compliance plan, is what we do with the Guard. The Guard helps you to meet all of these expectations and for you to be able to print out the outcomes to show the government that you're doing this yearly and that you have everything in place. That is my presentation. Are there any questions about what we talked about?
Yep, Bob, just give me 1 second. Let me start. Okay, so I completed a risk assessment last year. Do I need to do it again this year?
You have to do the risk analysis every year, and you have to remediate any items that you find wrong. As I said before, your practice, your organization, your hospital, it changes daily, weekly, monthly, yearly. So what this new, and then as you do the new audit, there may be things that you forgot, and so you want to be refreshed on that. And so you have to do the risk analysis, privacy, security, breach notification, technical, physical, every year to show the government you have a good faith effort going on.
Okay, next one is, how often does CMS or HIPAA audit?
It's an ongoing process. That's all I can say. You got to remember this, there's 4 to 7 million sites. They hire companies to do it. Okay, so when they see, when they go out on this first set, they're going to start targeting, because they already know from the 350 sites that they did, they know what size organization they're going to target. They know what size organization's not complying already. So if you fit that demographic, you're going to get audited. And they're going to start sending them out, and it's easy for them because what they're going to do is they're going to come on site for some, and they're going to do like they do for CMS, they're going to email and request you for your compliance documentation. And if you can't supply them with the proper documentation, then they may send somebody out, or they may just fine you right there. So it's an ongoing process. There is no set standard time frames for it. It'll be every year for the rest of time. Let's put it that way.
Bob, next question is, what are some examples of the fines that practices are getting?
As I said before, as we said back up here, the normal, and let me go back up here for a second. What I'm seeing in the fines is the average is around 125 to 225,000. 125 to 200, yeah, 225,000. That's a lot of money.
Okay. Next question is, what triggers an audit? How do they know that they should audit you?
Just like I said, right? So what they've already done their homework. This year right now they put out 350 audits for business associates, small, medium, and large entities. And from the information they got back, they already can tell from the size, because they've already got a database of all the practices. They know how large you are, they know how many sites you have, they know how big you are, and what they're going to do is they'll take that information that they got from the 350 sites and they'll start with the high-risk people, the people that they know already that are probably not complying. And that's how they're going to send out their audits.
All right, next one. Let's see. Is there an insurance policy available that helps an entity with these fines?
It's a great question. So here's the deal. There are insurance companies out there that sell cyber insurance, right? If you sign up for our cyber insurance, if you have a breach, we will pay for the breach notifications and all that. But they don't tell you the fine print. It's kind of like your car insurance, right? If you drive drunk and you hit somebody, your insurance company's not going to pay for it. They're going to say you were in willful neglect. Same thing with HIPAA. If you face a cyber breach and you didn't do anything for HIPAA and you're found in willful neglect, they're going to say, I'm not paying. I don't have to pay. You breached the contract. Now, if you have everything in place and you did everything you were supposed to do, then they'll pay. But if you have everything you were supposed to have and you did everything you were supposed to do, you really shouldn't have a breach. So it's kind of, it's kind of, to me, kind of a waste of money if you're already compliant.
Next one. Is it true that anyone can report an organization as far as an incident?
Yep. Your patients, a disgruntled employee, an employee, somebody, you know, the insurance company, right? There's many different places that could report you, right? Usually the places I see, the people I talk to, because we have a hotline, the people I talk to that are disgruntled employees, disgruntled patients, or patients that have been wronged or feel they've been wronged. They don't even have to, they just feel like you wronged them, right? Maybe you didn't. Doesn't matter. They can report you. And then it's up to you to defend yourself against the government. You know, we all know how that goes with taxes. So unless you have all the documentation, you know, it may not come out good for you.
Next one is it okay to email a patient their records if they just have standard email? Not secure, in other words.
The only way that you can do that is if the patient requests that you send it unencrypted and they sign, for me, I would have them sign an authorization that's okay, right? So I come in, I say, I really don't want you to send that stuff encrypted to me anymore because I don't know what I'm doing. I want you to just send it open text. Okay, please, here, sign this authorization form. Okay? And so then here's that, okay? So if you're able to do that, right, you're able to give them that information, you're able to give them information if you get an authorization form signed by them that they're requesting that, and then you save it in your EHR.
Okay, so just want to make sure we got it. So I'm just making sure we've covered all the ones. I think I may have. If I completed a risk assessment last year, do I have to do it again this year? Do we ask that one?
Yeah, I think so. Yeah, you do.
Okay. Oh, okay. Another next one. I'm sorry. Just one minute. If I fail my CMS audit, does my EHR share in the penalties?
No. It depends. Well, I shouldn't say that. It depends, right? If you fail your CMS audit, right, and it's because your EHR system doesn't track the 17 requirements, okay, that they're supposed to be, like smoking and this and that, whatever they're supposed to be tracking, right? If they're not tracking it properly and you fail that way and you have to give the money back, there may be some things in your contract where you can get the money back from the EHR. But if you're talking about your compliance, no, that was all on you. It wasn't on the EHR. You were supposed to be compliant. You were supposed to be compliant under HIPAA anyway, right? So the HIPAA would cover you for CMS. CMS is just asking for the documentation. But as we all know, most people aren't compliant with either. 80%, according to the percentages.
What do you do with a business associate that refuses to sign our BA agreement?
Okay, so if their BA agreement, so you would either need a lawyer or you would need a compliance person like our coaches to review that business associate agreement they're trying to make you sign. I will tell you this, if you are doing it yourself and you're just accepting whatever business associate agreements that's coming your way, you may want to go back and look at them. Because I will tell you that I've seen some really, really bad business associate agreements that will impact the covered entity if there's a breach by the business associate. For example, if you see an indemnification clause that says something like, if you breach, you'll pay, and if I breach, I'll pay for mine, you pay for yours, that's not going to come out well for you. That's not going to, you're going to have a hard time. You're going to pay a lot of money because your business associate breached you. what your business associate agreement indemnification clause should say. If I breach it, I'll pay. If you breach it, you're paying for everything. You're paying for the lawyer fees. You're paying for the credit reporting. You're paying the whole ball of wax because it was your fault. You should have been compliant. And you'll see a lot of people balk at that. They'll balk. They're just because, you know what, they've only been in business for 2 years and they're not compliant, and they don't want to take on that responsibility. If you find that, then you know what you need to do? You need to find somebody else that will do that for you. You need to find a HIPAA compliant business partner that will stand behind their work, and they will make sure that, you know, if there's a breach, they will cover it.
Hey Bob, if someone's using the Guard service and they have that type of a question, is that something the HIPAA coach could help them through it?
Yeah, the HIPAA, if they're using the Guard, the HIPAA coach will do the review. So for example, there are some companies out there that I've done reviews for their contracts already. For example, Trizetto, and there's some other companies out there, some EHRs I've done, where I have seen where they're fine, right? If there's a breach, they'll pay for it, you'll pay for it. But it's some of these other companies where, you know, you're utilizing like collection services and things like that, where you're sending them a bunch of, you know, information, and they're saying, no, if we get breached, no, you're going to pay for it. No, wow, really? No, that's not the way it works, right? And so we kind of direct the customer to find somebody new, right? We don't wait. We suggest, right? I can't tell them to do anything, right? So we're going to suggest strongly that, and they'll have to make that decision that they're going to have to get rid of them, or maybe they can't comply with HIPAA, right? You have a lot of mom and pop shops out there that some people are using that aren't HIPAA compliant, and you're sharing a bunch of information with them, which could jeopardize your whole organization or your whole practice because somebody breaks into this person's house and steals the server, and all your information's on there. You're gonna hate that. You're gonna hate trying to defend yourself of why you were using that person when you could have used somebody else that was compliant. So I want you to think about that one also.
That's also why, and I think you spoke a little about it, Bob, the examples of organizations like Fitbit, that, you know, by illustrating their HIPAA compliant, it is a noticeable differentiator in the market, and ultimately drove their stock price up.
Oh, absolutely.
Okay, we're coming up on the hour. If there aren't any more questions, I once again want to say thank you to George and Apex for being kind enough to let us speak to you folks. We do hope that you will follow up with George and Apex for any of all the things you saw here that hopefully you knew you should be doing. If you were not doing them, you know, please do follow up with Apex to make sure that you have solutions in place. In the end, compliance does not have to be hard. It can actually be it can better your organization, and I do hope that you will work with Apex to do so. George, thank you. So far, again, no more questions. Anything else, George, or do you want to close it up?
Nope. I know there's a number of Apex clients on the line, and if you'd like to get a demo of the Guard or get more information, you can reach out to me or your VCIO, and we'll make that happen.